New York Academy of Medicine was established in 1847 by a group of physicians who were concerned about the quality of care in New York. And since then, we've been very involved in a whole series of important public health issues in the city. Our current priorities are healthy aging, prevention, and eliminating health disparities. Prevention is, we believe, the key to improving the health of the population.
It's wonderful to provide access to care and treatment to people when they're sick, but it's also important to try to avert disease whenever possible, to prevent suffering and to prevent healthcare expenditures that could be devoted to other investments.
There are two important ways of intervening on prevention. One of them is personal prevention. The second very important area, and the evidence is increasing about how important this is community-based prevention. There's very good evidence that preventive activity makes a difference, and increasing evidence, especially in areas of tobacco, exercise, diet, and alcohol, that we can actually make interventions to create healthier communities that make the healthy choice the easy choice for everyone. We have several important programs and partnerships at the New York Academy of Medicine. One of them is SAFE.
The Strategic Alliance for Health is a city-funded initiative working primarily in the South Bronx and East Harlem and increasingly across the city to try to make policy change happen to support healthier eating and more physical activity.
The New York Academy of Medicine and the New York City Strategic Alliance for Health have been working together collaboratively for the past 2 years. We function and operate in 2 different capacities. They evaluate our obesity prevention projects in 3 different communities.
We got a lot of our participants, our camp organization, through SAFH's help.
We want to challenge them to not give up. It's a big confidence builder if they can get up the hill all the way without giving up.
One program that I'm really excited to see this summer is the Play Street initiative. The main goal for us initially was thinking about, okay, how can we get kids physically active that don't have the opportunities? But in other Play Streets, there are opportunities to have healthy meals presented. The whole health concept is embodied in this Play Street. It's like you can be physically active and you can have a healthy snack right afterwards. And every group that's hosting it recognizes that and is pushing that to their community at large.
One of the important prevention programs that NYAM is leading is a statewide effort to prevent obesity. We call it DASH.
DASH is Designing a Strong and Healthy New York. It's a 5-year project funded by the State Department of Health. DASH is a new collaboration of 30 different statewide partners working toward preventing obesity across the state through policy change. One of the exciting things we did this year was we hosted a symposium called What Should New York State Do Now to Stop Obesity? In that forum, we were able to highlight initiatives that local communities and teachers and others are implementing in their classrooms and neighborhoods to improve the way people are accessing healthy food and their opportunities for exercise. One of the people we highlighted was Steve Ritz, who's been working with students to introduce mobile edible wall units. It's a very innovative way to teach students about healthy eating and to teach them an interesting new job skill.
In my classroom, using that unit, we have routinely grown enough food to feed 450 students in the South Bronx a healthy and delicious meal.
And in that 5 minutes, I was able to paint a picture of what is going on in the Bronx. And as a result, my program took off. I heard from people and resources and was able to network in ways I've never imagined. Last week I was in Washington, D.C. I mean, again, I'd have to credit NYAM for that.
A strength of NYAM is that we have a policy center. We also have an evaluation center. We do research. We have programs. So we here in one place have the gamut of services to society, and we can take information from those experiences and move a policy agenda forward that really improves the life and the health of people in New York.
Anytime you present a policy proposal or campaign in the city of New York, you have to produce evidence. To allow our community-based ideas to be evaluated in a rigorous way truly gives us the opportunity to work with community in a way that I don't think we would have done had we not had their support. The New York Academy of Medicine has given us the opportunity to really do our community-based initiatives with an area of confidence that we would have never had.
The other aspect of prevention that is a change is the importance of working with older adults and the increasing number of older adults in our society, many of whom have the kinds of chronic problems like heart disease and diabetes, cancer, pulmonary disease, and all of these are complicated by obesity. So really focusing on creating healthy communities where the healthy choice is the easy choice is a very important strategy. And one of the ways for older people to stay healthy and engage in their communities is to stay physically active.
We have 3 aging improvement districts in New York City. In the aging improvement districts, we go out and we talk to hundreds of older adults about what they'd like to see improved in their neighborhoods. Older adults in East Harlem told us that they hadn't visited the pool, in most cases, in many decades, and that if there was a time when there weren't so many children in the pool and when it wasn't so crowded, they would definitely come and visit the pool. And so the Parks Commissioner listened, and because of our hard work and partnerships with City Councilwoman Melissa Mark-Viverito in the neighborhood and with many community organizations, we had today the first of the senior hours.
Right? We want to make opportunities and provide opportunities for people to have exercise and to have healthier lifestyles. So I really want to thank the New York Academy of Medicine for working with us to make East Harlem the first aging improvement district in the city of New York.
And this is really about prevention, because the longer that we can keep people in their homes and engaged in the community, the more they can contribute to our society, the lesser healthcare costs are. So we see this project as really a way to transform the city for all of us as we age.
Well, if we're successful working on prevention, we ought to see a few things. One is that I hope to see prevention being a much more visible part of the policy conversation, and also decisions being made in New York State and nationally with our partners to begin to shift some of the very significant financial resources that go into health policy into the prevention space. The other thing we believe we'll see is actual programs in place, especially in East Harlem. We intend to work with our partners to make sure that that happens over the next few years, to really create the opportunities for the healthy choices, the green grocers, the streets that have ability for kids to play, schools that are purchasing healthy food. So we ought to have very specific examples of programs that are working. And then finally, I think over time, we hope New York City would be the healthiest city in the United States, if not the world.